Hello, my name is Dr Ron Ehrlich and welcome to today's presentation. Actually, today's presentation takes a slightly different form in that we are going to engage in a discussion on the carnivore diet. The presenters, or the guests, are Dr Paul Mason, a Sydney sports physician, who delivered that very excellent presentation on the ketogenic diet in terms of improving immune function, and one of Australia's leading fitness trainers, Aaron McKenzie, also based in Sydney, who himself had conducted an 8-month N=1 experiment on the carnivore diet to deal with a protracted autoimmune condition. So it is with a great deal of pleasure that I welcome both Dr Paul Mason and Aaron McKenzie to ACNEM 2020. Welcome, Aaron and Dr. Paul Mason. Aaron McKenzie and Paul Mason, welcome.
Hey,
Thank you.
Guys, I wanted to just touch base with you about the carnivore diet because it is out there, and I'm just wondering, firstly, let's talk about it. I mean, at the risk of asking the obvious, is it just meat? Where do eggs fit into that? Where does dairy fit into that? But tell us about the diet firstly, and then we can talk about what its implications on health may be.
Well, I guess there's many interpretations on what a carnivore diet actually is. The most common one is a misunderstanding, and I'm surprised how widespread this is. But and that's just that it's a diet that includes meat, whereas that actually refers to an omnivore diet. So a carnivore diet really refers to a diet that is devoid of any plant food. And then you have, different interpretations of that as to whether that would include dairy products such as butter or cheese or even eggs.
And now in your talk, Paul, on the ketogenic diet, you made a very important point, I thought, obviously that comorbidities were a major problem in this whole pandemic, but that's even on top of that, the whole presence of chronic diseases is as prevalent as it is, and these are preventable chronic diseases, and the idea that insulin resistance was a major underlying factor. And I know whenever I've spoken to anybody about cancer, heart disease, autoimmune, even mental health, it's always about insulin resistance. So just taking a step back a little bit further here, what are the implications of insulin resistance to the carnivore diet? What are the implications?
Generally, except for the glycogen within meat, a carnivore diet is essentially a zero carbohydrate diet. In actual fact, many years ago, when it was first becoming known to the deep corners of the internet, it used to be called the zero carb diet. And by definition, the elimination of carbohydrates and of something else, which is called lectins, which are carbohydrate binding proteins, which have actually been shown, some of, to actually bind to insulin receptors, though the elimination of those two things actually tends to lead to a significant improvement in insulin resistance in fairly short order. And this is actually objectively measurable through blood testing.
Now, one of the things that a good diet, always stresses is we must incorporate vegetables into every diet, particularly above ground vegetables or lower carb vegetables. But Aaron, the video that we're sharing with our delegates outlined some problems with vegetables. I wondered if we might just touch on some of those. You've mentioned lectins as one, but there are others, aren't there?
Well, yeah, definitely. For me, I mean, I did a very strict carnivore diet for 8 months. I got all the way through to Christmas, and that was kind of just a point where I thought, okay, I'll have big family lunch and I might try a few other things. And that was kind of the starting date for me to experiment with an elimination process. And it was around when I went back and saw Paul and said hello and talked to him about my neck and my issues there, and we talked about my blood results and stuff. And I mentioned to him that I was going to start experimenting with some veggies. And it's been quite interesting because the last 4 months of doing that, I've basically gone through all the different possible vegetables that I could reintroduce one at a time, and learnt a lot about how my body responds to those in terms of the symptoms that I was able to alleviate, psoriasis, kind of joint inflammation, from eliminating them. And then when I've reintroduced them, studying each one at a time and figuring out, well, what's causing the reaction? Is it like the lectins, like Paul said? Is it like he was talking about just now, is oxalates? Is it saponins? Is it phytic acid? All the different plant phytochemicals that are there that are part of their protective mechanism, and just going through and seeing, well, what am I more sensitive to? And it's been a pretty interesting journey in terms of understanding how each thing affects me differently and the different symptoms. So like Paul was talking about with that reversal of, or just with insulin sensitivity straight away. And what I did as part of my test was I used one of these CGMs, the continuous glucose monitors. So that was really quite fascinating. So, you can just do that and just check it. And with a carnivore diet, rock solid, stable blood sugar all the time. I'm sure you can see that, 5.4. The only things that budged it were when I trained intensely, my blood sugar would go up. Going into very cold water, so ice baths, made it drop down, or getting very hot baths would make my blood sugar go up. But other than that, very stable. Drops a little bit when I go to sleep, and then I get a morning spike to get me going in the day. But even after eating, 2 good meals a day, rock solid, stable. So what Paul's saying about the whole insulin sensitivity and just looking after those people that are in that position, spot on. But then when I started reintroducing plants, you can see there's variances. And I've been using these CGMs with clients, which has been fascinating, especially with a lot of challenging clients that have tried the keto, tried the paleo, autoimmune paleo. They've tried all different things and, kind of reach a point where they just can't get a result. And that's kind of where I was at before I started the full strict nose to tail carnivore approach. And I've found it's been remarkable. And for them, just the learning. So, for example, a client has something and they think, fruit's healthy, or this particular pumpkin's healthy, or kale's healthy. And they can see the changes in their blood sugar with having just different plants, not just because of the blood sugar response because of the carbohydrate, but because of the anti-nutrients or because of the stress that it's putting on them. And I found that really fascinating as an awareness tool for them, because I still found that I had a lot of clients that, even though they were listening to me and it made sense to them logically to have a low carb approach, and they thought they were eating very healthy, but they just weren't getting the results. But having that feedback with the CGM, as well as using an Oura ring, which looks at their sleep quality and their deep sleep and their light sleep, just found it quite good. Other than going to doing all these expensive food intolerance tests and allergy tests to get everything tested and spending all that money, but then they still feel kind of disconnected to it. This puts them in a real time kind of situation. And I heard Paul mention that in one of your lectures, I'm not sure, probably a year ago or 6 months ago, at least, about the CGMs. And I just thought, far out. And I looked it up because I remember they were quite expensive, but this now, $95, it's so worthwhile for anyone that's challenged by nutrition and just wanting to get answers and feels frustrated. It's been awesome.
I've worn one of those for 3 weeks, and I've found it to be really interesting. Freaked my wife out every time I lifted my arm out.
Yeah.
But it's been good. But the carnivore diet's often offered as a alternative where some really frustrating autoimmune conditions occur. Has that been your experience, Paul? And why would that be the case?
Well, look, at the root cause of autoimmune disease, the traditional teaching in medical school is that it relies on something called molecular mimicry, which is basically where the immune system gets confused between the molecular signature on a cell of our own and mistakes it for something that's foreign. And if we actually have a look at what shares some of those similar molecular signatures, basically each cell we have has got this little stalk. It's called a glycoprotein, and it's covered in them, and it's a little bit of protein with a little bit of a carbohydrate cap on it. And that the signature on the top of that cap is quite unique to that cell. And it just so happens that some of these dietary lectins that can be found in food, especially the plant lectins, can actually share that exact molecular signature with some of the cells in our body. And if we have stomach problems, increased intestinal permeability, more commonly known as leaky gut syndrome, then these lectins, the plant-based lectins, can actually be absorbed across the gut and actually be exposed to our immune systems, where our body can generate this aberrant immune response. Now, ostensibly, it's a reasonable immune response initially because it's perceiving these plant-based lectins as foreign, but unfortunately, if they share that same molecular signature, the products of the immune response can then cross-react with our own healthy cells. So the process is that if we actually remove some of these harmful lectins from our diet, we can actually dampen down the immune response. Now, this doesn't happen overnight. If we have a look at the antibodies after somebody associated with celiac disease, for instance, we know they can still be circulating 18 months after a provocation. And gluten, by the way, is actually a type of lectin. So it doesn't happen overnight, but it does happen, and it has been shown to happen. For instance, there have been studies looking at antibody levels against thyroid hormone in females, and they have actually been demonstrated to fall after eliminating gluten from the diet. So we're actually right on the cusp now. We're moving away from a purely theoretical construct, and we're now starting to see more and more evidence. And certainly in my patients in clinic, I've documented in literally dozens and dozens, we actually see falling levels of intestinal inflammation, which is measured by something called fecal calprotectin, and we've witnessed falling levels of antibodies against various tissues. And as you know, traditionally, antibodies have just been thought to just gradually and relentlessly increase with age. And yet I'm having patients who we're documenting antibody levels falling from pathological levels down to levels within the normal range and even becoming undetectable. So it's once we have this holistic understanding of autoimmune diseases and actually the root cause of them, rather than just thinking about them as something that just happens because of our genetics and because of our environmental exposures, none of which we understand anything about, we can get a whole lot more clued in. And there are some things outside our control, such as infection, that do trigger them. And this too is very understandable, because if you recall, I said our cells had these glycoproteins sticking out, identifying them. Well, sometimes they've got a protective buffer on top of them called a sialic acid residue. And that actually, even if you have immune cells or effectors circulating with potential to react to that cell, if you have this sialic acid buffer on top, it basically prevents the immune system from doing that. Well, guess what? If you have certain types of infection, that can actually strip that sialic acid away from the top of the glycoprotein. And we know that certain infections, such as streptococcus, are renowned for triggering immune reactions. If you have a look in any medical textbook at the so-called cause of type 1 diabetes, you'll see that infection is listed there near the top. Why is this? Well, it's not so much that the infection actually causes the autoimmune reaction. It's just that it's that last straw. The immune system's already been primed, and that just lets the final hurdle just be cleared.
Well, Paul, you'll be pleased to know that another part of our conference has been obviously looking at many of the environmental toxins, most of which are lipophilic, and the infections we're covering as well. Particularly, with my background in dentistry, oral infections are often ones that are completely overlooked and often ignored because there's often no pain associated with it. But you were talking about gluten, and of course celiac is one thing, and non-celiac gluten sensitivity is another. Putting gluten aside, where do vegetables pose a threat to the immune system? I mean, Aaron, I know you...
Before we talk about the vegetables, let's just talk briefly for a moment about celiac disease and autoimmune. For instance, it has been shown that maternal ingestion of gluten during pregnancy will influence the rate of type 1 diabetic development in her offspring. Wow. So gluten is pretty significant. So I think, and the effects are more predictable and further reaching than most people realize. Now, when it comes to vegetables, there is a class of vegetable that is certainly more deleterious than others, and that is called the Nightshade Family. And they're the common things: tomatoes, capsicum, or the Americans would call bell peppers, aubergine or eggplant, chilies, even things like goji berries, okra will fall within this family. And these are, in my patients, I tend to find they tend to be associated with the inflammatory joint pain. It's probably that molecular pattern that they're associated with. And I recall back in the 1990s when I was actually studying physiotherapy, I was actually had a very experienced clinical tutor, and I was actually taught. I saw patients with him, and he was telling me how this patient had tomatoes would stir up their particular kind of arthritis, and they had clinical benefit with cutting out tomatoes. And this knowledge has been passed down, and it's almost anecdotal. But for me, it was very exciting when I started learning about lectins and how it actually interacted with the immune system. That was the very first time I could actually understand there was a relatively rigorous science behind some of the practices which clinicians have been doing literally for decades and decades, if not generations.
Mm. Now, Aaron, you approached this and you did your own experiment, N equals 1. You know, you were following your blood chemistries, but your symptoms that you were talking about there were some autoimmune problems.
Definitely, yeah.
Tell us
when I went to Paul as well, because I went to see him and he did some comprehensive blood work, and we were able to go through that, which was very interesting. And I had some autoimmune things there, but and over the last kind of 3 years, I'd started to notice them more and more. And one of the drivers for me when I first started getting into nutrition at the age of 16 was that I was covered in a skin condition, and nothing could alleviate it. I went and tried all different, drugs and topical things. And then it wasn't until I started cooking my own food and getting into just whole food eating that it dramatically changed my physiology, changed my skin, changed my outlook on life. All my markers of health, much more positive. So that really kind of got me going into it. But more recently, over the last 3 years, I'd noticed that I was getting psoriasis, and I've had joint problems. I had an old joint injury that I've had for 20 years, but it was just kind of constantly just an awareness that was there. And I was doing everything mechanically to try and alleviate it. But in the first couple of months of doing the experiment, those things didn't change too much. But by the third month, actually they got worse at the beginning. And what I theorize is that was the oxalate component, because part of my regimen before was a daily dose of raw cacao keto desserts with huge amounts of cacao. And I was high dosing on curcumin, on turmeric. And both these things have huge amounts of oxalates in it. And I thought, I was doing the right thing and just, having my keto desserts and having my having my healthy cacao, and then having turmeric for inflammation, which when I first started, I have to say I did feel some alleviation from joint pain. But I think that the oxalate load caught up with me. And when I took all these things out, I felt worse. And I read up on it, and I spoke to different people, and they were saying, there's a dumping component. And then sure enough, 2 months later, and the third month, I started to feel better and better, and my skin got better and better. And now, so it was my wife's birthday the other day, so I had she got a chocolate cake, really rich chocolate cake. So I had that, and straight away, I can feel the back of my throat swell up. My skin the next day, broke out with my classic psoriasis pattern, inflamed after it. And then that evening, I had this sensation to urinate, which is the oxalic acid and my body trying to get rid of it. And then, the next day, the psoriasis spots were all kind of red, then the skin dried and it flakes off and it goes away. And I've done that over and over. In the last 4 months, I've just tested different things like that just to see, you know, and it's only me and, you know, clients that I work with. And that was why I did it, because you can read all the research, you can read all the studies, but until you feel something and see it in yourself, you don't really feel that sense of ownership and connection to it. You know, you're just kind of reading this study, that study, which everyone knows, you know, with epidemiological studies, it's quite challenging, even if there is a mechanism there that's explained. But when you feel it and see it in yourself and it's that dramatic, it's powerful. And you see people that are struggling all the time with inflammation, and, you know, people that are genuinely trying. And I think that's one of the biggest things world over with nutrition in general, is that you've got people that are really doing their best, but just the guidelines or the information that they have available to them isn't what's going to get them the result. And that's where we need to kind of open up more and just share what's really working for people. And it's diverse, definitely, but I think this carnivore thing really has some legs for people that have, you know, it's where I ended up at the end of doing, you know, 20 years of doing Western A price, doing, you know, paleo style, doing more, taking out all the grains, doing, you know, no gluten, no dairy, even, you know, Western A price, you know, all the preparation methods or raw dairy, all these things. I've tried all the different approaches, autoimmune, paleo. But, you know, I've ended up here, and you talk to a lot of the people that are getting the results with carnivore. And again, this is based off their own individual anecdotal thing, but they've tried the full gamut. You know, maybe they've gone vegan and got a result there. And the funny thing with veganism is that, or just, you know, that path is that most of those people are getting a result because they've taken out all the processed food. They've taken out and they've taken ownership, and it's a form of fasting, but then eventually it catches up. So they end up with these nutritional deficiencies, whether it's 1 year, whether it's 2 years. So they go harder, they become a raw vegan, whatever. But then the people that are at the carnivore stage that have gone through that, they're quite vocal about what they went through, because they don't want other people to do the same thing and fall into that trap, which, you know.
Well, you mentioned that with the gluten, that it sometimes takes up to 18 months for the body to heal. And I'm thinking with these other aspects of vegetables, lectins and oxalates, and that, what kind of period should we be expecting things to clear in that time?
Oh, with the gluten, I was just referring to the duration of antibody detection in the blood. Most people will improve in significantly shorter periods than that. Usually, most people, quite honestly, within 1 week of eliminating troublesome foods, tend to report improvements. And it really depends on, I guess, what particular poison, so to coin a phrase, they have a problem with. For instance, if it's irritable bowel syndrome that's exacerbated by FODMAP, so these poorly digestible sugars, polyols, sugar alcohols as well, disaccharides, and so on and so forth, you'll literally improve within a day or two. If it's a problem due to immune exacerbation, so lectins and things like that, well, the bowel inflammation will usually settle down within a matter of a couple of weeks. If it's a matter of nutrient absorption, well, not only does that require you to stop ingesting that, so that might be, you know, the tannins or phytates, those kind of things that are binding nutrients, but then you actually need a restorative process for the nutrient levels to actually return to normal. So that can be a little bit longer. The chronic inflammation itself that is associated with the autoimmune diseases is what I consider to be most deleterious for people. And that can take months before that fully corrects itself. But depending on the symptoms, gastrointestinal symptoms will generally improve the first. Then I think it's probably skin conditions would probably be the next one, and then generalized energy levels, well-being, mental clarity will probably then just gradually and progressively improve over time, but it can take several months before people reach their peak.
And of course, blood sugar changes very quickly.
Oh, yes. So that too is literally overnight. Yeah. So the simple fact is, if you have somebody with metabolic issues such that their blood sugar is not stable, if you don't put the sugar into the system in the first place, you can literally get a dramatic improvement overnight. And in my patients who are monitoring their morning blood sugars, it generally only takes about 2 weeks before you can normalize blood sugar levels in most people. So, and that includes diabetics, so non-insulin dependent diabetics. So you can be taking medications, maybe a sulfonylurea or a metformin or something like that. But if you're not requiring insulin or some of the other fancier stuff, you can usually normalize within a couple of weeks your fasting morning blood sugar.
And in your experience, in both your experience of what a carnivore diet means, does it mean eggs? Does it mean dairy? Dairy has its own issues, of course. What do you say to somebody who's looking at the carnivore diet as a potential therapeutic approach to a protracted illness? And what do you say?
Well, I think like all diets, it's personal. So, I mean, the carnivore diet isn't strictly necessary for every people. A lot of people can get away with having plant foods, and if they can eat plant foods and they don't have any deleterious effects, and there's really no pragmatic reason why they would want to embark on something like a carnivore diet. And if you do go on a carnivore diet, some people can tolerate dairy and some people cannot. I do have to say it is, when you actually dig down to it, dairy does affect a lot of people more than you would actually think. So it tends to be particularly constipating for some people. One of the metabolites, the beta-casomorphine, actually, similar to other opiate type effects, will slow down the gut. It does actually have an effect as a theoretical lectin as well in terms of modulating immunity. So that can be problematic. Eggs in and of themselves, I think eggs are nature's multivitamin, but it is true that some people seem to react to the egg whites, less often people to the egg yolks. So it can be a hierarchy. What I actually like to tell my patients is to try and be as strict as you can and then add back. And the process of adding back means that over time you end up on a much less restrictive diet, but you still end up hopefully with all of the benefits.
And when we hear about carnivore diets, I think people's minds go straight to muscle meat. And yet there's so much more in a carnivore diet than muscle meat, which is what we seem to be preoccupied with in our Western world when we talk about meat anyway.
Well, I think Aaron can probably talk to that point. I mean, with his experience going from, Western A price philosophies, which I have to say I think are very sound for the most part. But I mean, Aaron knows more about nose to tail than most anybody.
Mm-hmm. Oh yeah, no, so for me, I went the full, just whole animal. So that's all I ate for that experiment. And that was just part of my wanting to know, could one animal provide me all the nutrients that I need to heal my body in the ratio that the animal comes in? So in the brain, all the organs, so heart, liver, spleen, all the bones, the marrow, and that's quite full on. But that was just part of why I wanted to do it as an experiment like that, and that's pretty extreme. But for most of my clients, if you can get them to start to have some organ meats, the benefits are there. Like Ron, the whole Western A price approach is to try to convince people to have liver and to have the egg yolks and to have these really nutrient-dense foods. But I found a really practical way is for people to just find what's in their heritage that they align with. So a lot of people, grew up and their grandparents had pate or had some type of organ meat dish that maybe they were exposed to. I find that for some people that works. The simplest approach I kind of use as a starting point, and like what Paul was talking about, is that kind of elimination diet process. So I don't say to them, this is it and this is how you're going to eat forever. I said, look, if you've tried all these things and it's not working, here's a really basic way. And that I just do, they do steaks, they do sardines if they like those because they've got all the calcium there, which is really good. They do eggs, and then like Paul was talking about, the whites have to be cooked or you may not even have the whites. Then they have oysters are really great if they don't want to go near liver, and that's cool and that's what they want to do. But it's important to have the bone broth or the slow cooked stuff to get that glycine and collagen. I find that really helps. There are people out there, like Paul's aware of and I'm aware of, that are doing great on just kind of ribeye only, and they're quite vocal about that. And I think that, I don't know, I just think that long-term is going to lead to nutritional deficiencies personally. But I think these people are demonstrating robust health, so if they can do it, great, but I can't see how they could maintain that over a length of time. I think it's still important for us to get that spectrum. And like Paul said about the plant thing, I think everybody's just got to do what works for them. My process has been for the last 4 months is to try and reintroduce plants in a way that allows me to have optimal health, so that it's more socially acceptable, and just also to understand other people going through that process of reintroduction. And I've got people that can reintroduce things with no symptoms, and that's great. For me, I've been trying just one thing at a time. The only thing I've been able to get away with is carrots, bok choy. Doesn't give me a reaction. What's the other one? Just a few kind of cooking herbs just for flavor, which is nice. It's amazing. This is the thing. This is why I say, because I've got a lot of celebrity chef friends as well as clients and whatever. And I say, this is gold. If you want to get to know food and understand the sensation, the smells, the gustatory, the olfactory experience of just tasting things in an amazing way, the carnivore diet, even if you only do it for 2 weeks and you start adding one thing back at a time, everything just tastes so strong. The smells of everything, even just the different cuts of meat, the different tissues through the body, they all have this amazing textures and flavors that if you're just having so many different things all the time, you don't get to know. So it is, for any nutritionist, I think this is a definite that they should at least experiment, try it, get to understand it, and then get to know each individual food that they're eating. Because, to just talk about things without experimenting or experiencing, I think is, it leaves a lot out there for them to connect with, that they could understand more. Yeah.
Well,
just on my clinical observation on the nutrition sufficiency and whether you need to do nose to tail, I have several patients who don't do nose to tail, and probably the most common issue that I'd note is an apparent histamine intolerance. And I do wonder whether this may be due to a deficiency of diamine oxidase.
Yeah.
Actually a digestive enzyme that whose prime function is to break down excess histamine. And the histamine is something that we can actually consume and in deep cold water fish like sardines or mackerel, in aged meats, in fermented foods like yogurt or kefir. These kind of things can be very, very rich in histamine.
Yeah, sauerkraut.
Yeah,
sauerkraut was one thing that I was going to keep, but I decided not to because of the histamine factor, even though there's so much that's there. That's why I kept it out. But yeah, the kidneys have remedied that for me. So having just raw kidney or just searing kidneys helps a lot. And then I was finding I was getting histamine responses from doing lots of slow cooked meats and lots of bone broths. And then I switched to pressure cooking, which for all the tougher cuts, and I switched to pressure cooking to make my broth, which has been much more effective and alleviated that. And I've found with clients that do have that kind of histamine issue, like you're talking about, it could be maybe that they're having leftover meat, so they've cooked stuff, but they're not just having really fresh meat all the time. That could definitely happen, especially with the slow cook. I was finding that I wasn't having outbreaks in my skin, but what would happen if I made a big slow cook and I was having lots of bone broth? I feel that my digestion wouldn't be as good. And here's a funny story. I mean, it's not funny, but I ended up in the emergency ward. One of my first meals eating out after was going to a fish restaurant. It's quite well known. I won't talk badly about them, but it just happened that they had some kingfish, and I got that, and we went with some friends, and a couple of them had it as well. And my wife had the battered fish, so she had the unhealthy. I had the grilled kingfish, and so did two other people. And when I was sitting there eating, and I could feel my tongue kind of swell up, and looked around, and my face started to go red. And I looked across, and one of the girls, she had it as well, and then her mother had it. And their faces were going bright red. And I said, I don't feel so good. I think something's happening. And we had a histamine poisoning from the fish. And it was so extreme. And my heart rate I had tachycardia. My heart rate went through the roof. So I was at above 220. I was incoherent. My blood pressure dropped. and I was in emergency for 6 hours from histamine poisoning from the fish. So I know at the very extreme level of histamines now, and it wasn't pleasurable.
Yeah.
But
What do you say to people who, because of course vegan has become a very popular approach to health, and vegetarians saying they can get all their protein from vegetable sources. What do you say to that?
If you actually have a look at protein in terms of completeness or biological availability, there is no doubt that animal sources of protein are better. There is no single plant source of protein which is complete. And you will read varying things on the internet, blogs that will contradict that, so on and so forth. But if you actually have a look at the science, you do not have the required requisite amino acids in the required amounts from plant foods. And that is simply a fact. If you actually have a look at protein needs as well, the science based on how much we need is quite poor. I wouldn't quite go far as say junk science, but I'd say incomplete science. The recommended amount of protein, the RDA, is roughly about 0.8 grams per kilogram per day. And yet we know that when you have a significantly greater than that, in excess of double that, there will be improved physiological function, including there have actually been randomized controlled trial that showed that with sufficient nutrients, other micronutrients, it is a requisite that you be on a higher protein diet to reverse osteoporosis, because essentially bone is just mineralized protein. The way that the guidelines were actually established was based on the understanding that protein is used as a structural substrate for building tissue. But proteins can also be used to enzymatic processes and things like that. And this essential role of proteins was basically excluded from the research that was establishing the dietary recommendation. So people who think that you can actually do well and do better on a low protein diet, I believe, actually belies what the evidence shows. And there have been studies that show that people on what would be considered very, very high protein diets do so without any impairment of their renal or hepatic function, their liver or their kidneys.
And when another devil's advocate here, that high meat intake promotes inflammation, putting it out there. What's your response to that?
Well, it's actually interesting. It's very visceral. People will describe how meat rots in the colon, and that's inflammatory and it's very fatty, and that leads to increase in lipopolysaccharides and so on and so forth. So let's address these things one by one. So if I did a couple of colorectal surgery terms as a junior doctor, and would have patients with their colostomy bags, which is basically where the intestine would be redirected outside the abdominal wall, and you'd collect whatever fecal matter was passing through there. I'd speak to these patients, and they learned pretty quickly that if they only ate meat, there would be no residue coming out into that bag. It would be liquids only. Whereas if they had plant matter, there would be a hell of a lot of residue. What does that tell you? That tells you that everything within the meat that they were ingesting was being totally absorbed. So in the acidic environment of our stomach, meat is incredibly rapidly absorbed, and our body likes to use it. There's no reason for it not to take up. Now, if we want to talk about what actually rots in the colon, well, another name for something rotting would be fermentation, bacterial fermentation. And that's exactly what happens with plant matter like fiber. And fiber only comes from plant matter. So if you're worried about things rotting in the colon and contributing to inflammation, you ought to be more concerned about what's in plant foods. Then if we come on to something called lipopolysaccharides, which are supposedly these inflammatory things, and they're animal foods, which are higher in saturated fat, will actually lead to an increase in lipopolysaccharides. And it has actually been shown that these lipopolysaccharides, which can basically be absorbed into chylomicrons in the digestive process, can activate something called the toll-like 4 receptor. Well, here's the thing. Not all lipopolysaccharides are equal. And the lipopolysaccharides that result from saturated fat ingestion actually inhibit the toll-like 4 receptor. They don't activate it. So they're actually anti-inflammatory. So when people are measuring LPS and they're assuming that that correlates directly one-to-one with inflammation, and they're assuming it contributes to inflammation, they're exactly wrong. The reverse is in fact happening. So I would actually argue in terms of animal foods, protein, saturated fat, they are not inflammatory, they are anti-inflammatory.
Mm. And I mean, this is where environment and health cross over, doesn't it, really? Because there are differences in meat when we talk about meat. Not all meat is equal.
Not all meat is equal, but I disagree with farmed meat, heavily farmed meat, grain-fed meat, certainly from an ethical perspective. I don't think animals ought to be raised like that. And from an environmental perspective, the environmental degradation that is done from cropping is undeniable. Every time you take a till to soil, we actually strip away the valuable topsoil, which by 2050 we're going to be down less than 50% of the topsoil that we've ever had. This is a non-renewable resource, and this is going to be absolutely catastrophic. So I think the idea of growing crops to feed animals makes no sense when they can eat grass, which is a renewable resource, and them eating grass actually leads to regeneration of topsoil. In actual fact, ruminant grazing is the only process I know of that can actually restore topsoil. So from an ethical perspective, I think that eating pastured meat that's able to freely roam makes good sense. From a nutritional perspective, there certainly is differences in the quality of grass-fed meat versus grain-fed meat, not least of the omega-3 content. Certainly, I think that the fact that grain-fed meat can, if it's been grain-fed for long enough, end up having 0 omega-3 is concerning, but I don't believe that the omega-6 itself is inherently inflammatory, as a lot of people worry about. Certainly in seed oils, which are heavily oxidized, that's when the omega-6s can be problematic. But the omega-6 in meat is not oxidized unless you're eating rancid meat, because the definition of rancidity is oxidizable fats. One topic that is irrespective of whether we're talking about plant foods or meat-based foods that nobody talks about is the nutrient depletion of soil. And that will affect animals that are grazed on that soil, and that will affect food that is cropped or grown on that soil. And it's actually been shown that for some nutrients, compared to the 1970s or thereabouts, some nutrients are down to less than a quarter of what they were. And it's probably even worse now because a lot of this data was still 20 years old when they came to that conclusion. So I think that we should be talking about soil health, nutrient depletion of soil, and having a look at how we're getting our meat, whether it's sustainably and ethically sourced. But in terms of the nutrient quality of it, if people can only afford to have the cheaper cuts of meat and they can't afford to go out and spend, $30, $40 a kilogram on meat, that need not be a problem. That you will still be getting valuable nutrients.
I spent just to cut in on that, I spent $11 a day for the 8 months.
Yeah. Well, you'd be interested to know that another aspect of the conference is actually in the latter parts of this conference in the last week or two, we're going to be talking about regenerative agriculture as an important part of this whole picture. And so this is exactly why I wanted to have this discussion today. And I want to thank you both for kind of introducing this concept, which will be an introduction to many people about the carnivore diet. It is very nuanced. It is very personalised. Vegetables pose their own challenge, and that needs to be considered on many different levels. So I wanted to just thank you both for joining us today for this discussion. And of course, Aaron, you've prepared a whole short video that will accompany this. So thank you so much.
Thanks, man.
My pleasure.